America, bonjour, hi, Canada. Greetings from California. I'm on the East Coast most of the year. I come to the West Coast in December and January. They've got a bill in California, by the way, to make it 60 days or less turns you into a California resident. I'm a Virginia resident, and I pay Virginia taxes, not California taxes. 60 days as opposed to 6 months. That's going to drive the state right into the ground, as all of the snowbirds are going to flee, including me. I won't be here 61 days, if that's the case, but that's just going to destroy restaurants. I think the desert will open up and swallow itself into the ground. Hank Adler wrote about that in the Wall Street Journal last week, but I digress. Good morning. There are two stories. The first story is the COVID relief bill was passed. The defense authorization bill vetoed by President Trump was overridden in the House and will be overridden in the Senate. And the House proposed adding $1,400 per relief check to recipients of the $600 relief check. It is highly unlikely that Mitch McConnell will bring up that proposal because there are very, very, very good ways to actually distribute an additional $450 to $475 billion. That's the estimated cost of the additional 14 that are far superior than shotgunning checks. Now, if you are in desperate need of that check, you object. You say, no, I need that money, and I understand that. Some people are behind on their rent. Some people's businesses have closed. Some people have no more savings. I would rather get you $5,000 than send $2,000 to people who are just fine because they have taken risks. We're not rewarding risks. This is a rescue bill. It's not a stimulus bill. Some people have been on the front line, doctors, nurses, grocery store workers, Target employees, Costco employees, all those people, Amazon warehouse employees, all those people have been out there working, but they don't need the $2,000 check. And so I do not think Mitch McConnell is going to bring it up. And I think it's because it is completely necessary to get relief out. But shotgunning, I just don't think that's smart. That's story number one. We'll follow that today, what Mitch McConnell does. Story number two is the vaccine distribution screw up. And this went everywhere last night. There are more than 11 million doses somewhere in the United States of the vaccine. Now, we got 350 million people. We got to vaccinate them all, although we're not vaccinating children yet until some studies come in. But we got to vaccinate them all. And there are some horror stories out there about onset of psychoses in a tiny, tiny number of people who had the virus in the spring. And secondary effects. I mean, we really do want to get this out there in a hurry. And it's great that we've got it. And distribution is, what a surprise, bollocksed up. That's because it's up to the counties. It's not a federal government, it's not a state government, it's a county thing. Now, there are 3,000 counties in the United States. They are called parishes in Louisiana and covens in Pennsylvania. And 48 states call them counties. Parishes in Louisiana and the Commonwealth of Pennsylvania calls them covens. So in the Pittsburgh coven, and it's Allegheny coven, actually, things are screwed up. And in Orange County, California, things are screwed up. And the reason I began investigating this last night is I knew I would call 1-800-520-1234. I'd like to hear from doctors, medical professionals, people involved in the distribution. I don't want to hear your opinion. I want to know from people, if there's anyone out there, what you think of the distribution of the virus vaccine. Because I talked to a doctor yesterday in Southern California. I said, what do you think? What's going on? And boy, did I get an earful. I got an earful. Let me go to read the beginning of this. Now you have hit a raw political nerve. When government takes control of a commodity, they usually screw it up, and they have. As a primary care physician, I used to have a primary role as a medical care provider in my community. I used to be able to take care of patients and make patient care decisions. More and more are being made by non-physicians, administrators, and bureaucrats. The bureaucrats do not live by the Hippocratic oath that I am obliged to follow. It makes no sense to me that vaccines are being distributed in a new manner and methodology other than the traditional route. Physicians should be able to get access to these vaccines and then vaccinate the highest at-risk cohort group. The highest at-risk cohort group are the frontline treating physicians and, most importantly, the elderly and convalescent care homes. It upsets me very much when I see low-risk individuals receive the vaccinations before the high-risk individuals get vaccinated. But isn't that part of a new cultural norm that the elites and those well-connected in political circles get priority. Isn't that just like socialism and communism in other countries? Do you want me to talk more? I have very strong opinions on the whole upside-down structure of the medical system. I said, what about Orange County, California? The problem here is that the Board of Supervisors, leading on the experience of the Orange County Health Department director, and that director is a psychiatrist. He is not in a position to be a public health director. The previous public health director quit because of the stress of the job, getting a lot of political negative comments, did not like it. The problem was with this person that she was an addiction medicine physician, not a public health official. Even if we have a public health official, they would lean to leftist approach to public health, which is a methodology beginning with top down. A public health director should not be creating governance rules and regulations. The Great Barrington Declaration, then it goes on. Is it screwed up where you are? So I began to investigate last night. Now, I am healthy 64. I'm not eligible for this thing for a long time. Nor do I need it because I can stay relatively isolated. And Dwayne tried to give me the COVID yesterday. He goes out and about on his scooter and therefore is exposed, but he tried to give it to me yesterday. But it wasn't successful. And I'm joking, of course. He's healthy and we want him to stay healthy. But I did hear of a friend who got it yesterday, and they don't feel so good. Hopefully it is one of the flu-like cases where they go down for 3 or 4 days and bounce back up and don't have the after effects. That is the vast majority. It will only, the fatality rate of this is below 1%. The serious side effects is way below 1% of recovery people, as far as we know. But we do want to stop that 1%, and we do want to stop the spread. Hospitals are jammed in California. I'm sure they're jammed in other parts of the country. And so we got to get this vaccine rolled out. And look, I used to be on a public health board, the Children and Families Commission of Orange County. For the 17 years I lived in California, I was a member of the Orange County Children and Families Commission. Met once a month. We gave away $40 to $60 million a year. The year that Gray Davis stole our money, we gave away $20 million, but we gave it away to children and families, children under the age of 5 and their families, to make them healthy and ready for learning. It was a cigarette tax. And the money came to 9 individuals, of whom I was one. And we had no bureaucracy. We had the smallest bureaucracy in the world. We made common sense decisions based upon applications. We kept the auditing to a minimum. We were never defrauded. We did have some people who couldn't deliver. They overshot, but they were not fraud, but wildly successful. I learned a lot from that, which is keep the number of people involved in a decision to a minimum, simple, clear direction. It's the way we ran law firms for years when I was active in the practice of law. It's the way we run this radio show. I give simple, clear direction to Dwayne, and he screws it up. Actually, then he gives simple, clear direction to Adam, who gives simple, clear direction to Harley and to Big Ben. And we shouldn't say Big Ben this week. That's bad luck. And if you're listening in the Pittsburgh Coven or in Cuyahoga County, pay no attention to that last comment. I went and looked on the Orange County COVID-19 Vaccine Task Force to see what's the plan in Orange County. It reads, the plan for distribution of a COVID vaccine is a phase 1, in which high-risk, high-priority groups receive the first limited trial amounts of vaccine. And as more becomes available, more groups are included until there is enough vaccine to serve the entire population. Good. Many of the policies and procedures for vaccine distribution will be developed by the Centers for Disease Control or the California Department of Health. Why not? I don't care. But counties have the responsibility of determining their unique needs. That's it. It's the county deal in terms of identifying priority groups for vaccine providers. Orange County Health Agency vaccine planning involves using input from our staff, from medical experts, and from the community to assist us in developing procedures that meet all CDC and state regulations while addressing the unique needs of Orange County. Central to our planning is a vaccine task force. So paragraph 3, no guidance yet. Comprised of members of at-risk groups such as healthcare workers, essential workers, ethnic communities, and older adults, and organizations such as hospitals, clinics, educational institutions, and businesses, as well as experts in ethics, faith-based issues, veterans issues, and various medical specialties. This group will address prioritization of vaccine recipients and how to address concerns about the vaccine among different demographic and workforce groups, and to make recommendations to the HCA planning staff and the HCA director. The task force was selected from input from a task force. We're talking now about task force. There is no guidance on where the vaccine is and who can get it. Nowhere on the web. just telling us about their task force, nothing about where to get the vaccine and when. That is a problem, and I suspect it's a problem everywhere. 1-800-520-1234. Counties, parishes, covenants.